I'm calling this meeting of the Children and Families Finance and Policy Committee to order. Members, we have a packed agenda once again, and we're going to hear from lots of folks today about our committee budget bill. Okay. Oh, you fix it again. Gracias, my IT person here, Mr. Chair. So the staff have asked to be, that we can be a little bit more tidy at the end of the committee today and going forward, although we only have today and tomorrow left. So try to keep your materials that we will be able to reuse tomorrow for our markup session. The first order of business is our approval of the minutes. Let's see here. Representative Nelson, will you move the minutes from Wednesday, April 2nd?
Yes, I would like to move the minutes from the Wednesday, April 2nd, please.
All right. Vice Chair Nelson moves approval of the Wednesday, April 2nd minutes. Members, any corrections or additions? All right. Hearing none, all those in favor, please say aye. Aye. Any opposed? The motion prevails and the minutes are adopted. So members and Minnesotans, today we have the walkthrough of our DE1 amendment to House File 2436, which is our Children and Families Budget Bill. First, we're going to ask Mr. Berg, our House Fiscal Analyst, to take us through the fiscal spreadsheet. The plan, again, is to do a walkthrough today and take no formal action until tomorrow. We will take clarifying questions, members, throughout the nonpartisan conversation, but please keep any substantive remarks until later on. So, Mr. Berg, if you would mind kicking us off here. Thank you.
Thank you, Madam Chair, members. First, in your packets, you should have a legal-size spreadsheet that looks like this that is dated in the lower right corner 4/6/25 at 8:58 p.m., which is the official version right now. And starting at the top of page one, most of page one is summary information, so I won't dwell on it too much, but looking at line 7, if you go over to the House columns, you will see that in 26-27, this has a net expenditure, net change of $25 million in 26-27 and negative $15 million in 28-29. That balances to the target this committee was given by the Ways and Means Committee. If you look down on lines 9 and 10, or 10 and 11, it shows you the total spend at our target and that the difference between that spend and our target is 0. I will skip over the rest of page 1, which is sort of the summary change information by department or account, and start with the actual change items at the top of page 2 on line 772, where Department of Children, Youth, and Families begins. The first item, starting at line 800, is the governor's recommendation for an operating adjustment for the Department of Children, Youth, and Families. If you look in the House column, the House has done the first biennium part of that and only a small amount of the mailing costs in the tails, $64,000 in the tails. On line 806 is House, not governor's item, the House food security item is a total spend of $1.5 million, and as you can see, it is split between the American Indian Food Sovereignty Program, food shelves, and the prepared meals program. On line 814 is House File 102, which is the child support modification item on change of circumstance when a public authority directs support to the obligee. That was $8,000 in 26-27 and 2 in the tails. Line 818 is Chairman West's House File 915, which has $500,000 in grants for camera equipment at child care centers. On line 822 is House File 776, which is Representative Hansen's Family Assets for Independence. It has a one-time appropriation of $419,000 to the FAM program. On line 826 is House File 2643A1, which is Chairman West's background study violation fines item. It actually saves $15,000 in 26-27 and $4,000 in the tails. On line 835 is the governor's recommendation for child care assistance federal compliance items. The House bill takes those the same as the governor's numbers. On the top of page 3, on line 843, the governor's recommendation for an electronic statewide attendance tracking system. The House does the first 2 years of that, 26-27, the same as the governor, and does not fund the tails. On line 848 is the Child Welfare IT Modernization Project. This is the SSIS project. The governor took $10 million from the prior IT appropriation and appropriated $10 million. The House takes, you'll notice at this point, $5.059 million of the IT appropriation and appropriates $40 million to the SSIS project. With the $10 million that was appropriated last year, that makes $50 million for the project, which is the upper end of the estimate last year of the state's cost for the program. On line 853 is the governor's recommendation to increase the capacity of the compliance team. This is a anti-fraud item. The House bill takes the governor's recommendation on that. On line 858 is the governor's recommendation to take money from the DCYF transition account. The House bill takes the $8.5 million and reappropriates $1 million of it back, and then gets federal match on that for a net cost to the general fund of $680,000. On line 864 is the governor's recommendation to cancel funding for the American Indian Child Welfare Initiative, as the Mille Lacs tribe no longer wishes to participate in that. The House bill takes that same amount of money. Line 868 is the governor's recommendation to reduce the Restorative Practices Initiative grant program. Governor cut it $1.5 million permanently. The House bill takes only $750,000 from the grant each year in 26 and 27 and makes that a one-time reduction. It goes back to the full amount in the tails. On line 872 is a House item to add $6 million to the Early Childhood Education Scholarships Program. That's a one-time appropriation in 2026. On line 876 is the governor's recommendation for the Great Start Compensation Support Payment Program. The House takes the same approach, which is there's no change in the funding for that program, but it does get put into a special revenue account so that, like the early learning scholarships, the money does not cancel and can be used more effectively by the department that way. There are several no-cost items that the governor recommended that the House takes. One is on line 884 at the bottom of page 3 that makes modifications to ICWA grant reporting requirements. At the top of page 4, there is a no-cost item that deals with relative foster care payments. Again, it's a no-cost item that puts kinship care into part of the program that it was not before. Line 888 is no-cost modifications to the Teach Scholarship Program, and 890 are technical changes that just are moving budget items around internally to straighten their budget out at the new department. And then similar to that, on line 892, the governor in his supplemental budget recommended there's part of the budget that moved from the Department of Education to the Department of Children, Youth, and Families. But after they looked at it, they realized that part wasn't supposed to have moved, and it involves Head Start and, I believe, Reading Corps. So that is realigned in the governor's budget. What you see here is a negative number, taking that part of the budget away from DCYF. Will come just a little bit lower down the sheet to giving that same money back to the Department of Ed. And then on line 896 is the governor's recommendation for $200,000 one time to put licensing information, federal compliance on licensing information on the licensing lookup system. The House bill takes that same approach. And then beginning on line 1431 are our other agencies. On line 1451, the Office of the Ombudsperson for American Indian Families. The governor recommended a modest operating adjustment increase, which the House bill also does. On line 1457, the Office of the Ombudsperson for Families. The same, the governor recommended an operating adjustment, which the House bill also does. On line 1463 is the item I mentioned, the Department of Education. This is appropriating the money that I referred to up on line 892. You'll see they're the same numbers. It's just these are positive, those were negative. It's taken away from the DCYF base and put into the Department of Education base where it should be. And the last item is on line 1469 is the Office of Foster Youth Ombudsperson. The governor recommended an operating adjustment, which the House bill does. I will note that on the very last line 1472, you'll see a negative 295 and a positive 295 that was carrying forward part of their money that was unspent. In the author's amendment, there will be a different approach to doing that, which simply carries their prior appropriation forward. And it will look like a negative and a positive in 25 rather than one in 25 and one in 26. The effect is the same. It's budget neutral, but it will show just slightly differently. And Madam Chair, that's the spreadsheet.
Thank you, Mr. Berg, for that walkthrough. Next up is our House research staff. Does anyone want to go first? All right, Ms. Punelli, you can kick it off for us.
Thank you, Madam Chair and members. The first article is the economic assistance article. The provision in this article came from the agency's policy bill, and it exempts the Commissioner of Children, Youth, and Families from contract term limitations for the issuance of public benefits through an EBT system. Under current law, there are limits to contracts and contract amendments such that they can't go beyond 5-year terms without specific approval by the Commissioner of Administration. And that's Article 1.
All right. Article 2, Ms. Sunderman.
Madam Chair and members, Article 2 is the Child Protection and Welfare Policy article, and this starts on page 1, line 12. Sections 1 through 7 and 26 are from House File 1424 as amended by the DE3 in committee from Representative Hansen. And these sections modify definitions, licensing and training requirements, and guidelines related to child foster care provided by relatives. Next, we have several sections. We have sections 8 through 25, 27 through 32, and 35 through 41. These are all from House File 1918, the DCYF policy bill from Representative Hansen. These are all the child welfare provisions related to inquiries into a child's heritage, extended foster care, case plan documentation, reestablishment of parental rights, non-caregiver human trafficking response, and reporting requirements for school attendance concerns. Section 33 is from House File 1614, the first engrossment from Representative Kraft. This modifies the definition of neglect in Chapter 260E for purposes of child maltreatment reporting to address situations where a child has to continue staying in the hospital or emergency department if the child has a mental, physical, or emotional condition and cannot return home, but for whom necessary services are not available. And finally, Section 34 is from House File 1346 from Representative Nash, and this modifies mandated reporter training required contents. And that concludes Article 2. If there aren't any questions, I'll move to Article 3. This is Child Protection and Welfare Finance, starting on page 51 of the DE. Section 1 is from the DCYF Governor's Budget Bill, authored by the chairs. This allows the DCYF Commissioner to contract with specified entities to provide permanency services for children in out-of-home care. Sections 2 through 4 are also from the agency finance bill. These sections modify MIFPA grant payment timelines and reporting requirements, and they remove the annual cap on special focus grant awards under MIFPA. Moving to Section 5, this is from House File 102 from Representative Curran. This allows for the modification of child support redirections when in the best interest of the child. And finally, Section 6, this is new language that outlines the requirements for the DCYF modernization of SSIS. And it involves reporting requirements and updates and that sort of thing. And that concludes Article 3.
All right, thank you, Ms. Sunderman. Ms. Mock, take us to Article 4.
Thank you, Madam Chair. So I'll start with Article 4, which starts on page 62. So Section 1 of Article 4 comes from House File 1158, which was Representative Hicks' bill. This makes the Diaper Distribution Grant Program a sole source grant to the Diaper Bank of Minnesota rather than a competitive grant program. Section 2 is actually a new provision that prohibits the Great Start compensation payments from being increased by 10% for child care programs that accept CCAP or early learning scholarships or are located in what are called child care access equity areas. Section 3 is from the agency's budget bill, and this section specifies data classifications for pieces of data from under the Great Start Compensation Payments Program. So moving on to Article 5, this is the Early Care and Learning Finance article, and it starts on page 64. So Section 1 comes from the A1 amendment to House File 2643, which was Chair West's bill. And this increases the fine that's applied to DCYF license holders who do not comply with background study requirements. So it increases the fine from $200 for each violation up to $500 for each violation. Section 2 comes from the second engrossment of House File 1915, although it's changed a little bit in this bill. That's also Chair West's bill. Under the bill, as heard in committee, it required cameras in licensed child care centers. Under the provision here in the DE1, child care centers aren't required to have the cameras, but if they do have cameras, they have to comply with the requirements that are in this section. Section 3 comes from the agency's budget bill. This establishes an account in the Special Revenue Fund for the Great Start Compensation Support Payments Program. Section 4 is, again, from House File 1915, the second engrossment from Chair West. This provides that the technology grants that are currently available for child care programs can also be used to cover the cost of video security cameras and related training. Section 5 also comes from the agency's budget bill. This modifies the TEACH scholarship program, which is a scholarship program for the early care and education workforce. And so instead of providing scholarships in amounts up to $10,000, the program will provide scholarships in amounts that are consistent with the national TEACH program requirements. There's also it also provides that scholarship applicants can work in certified license exempt child care centers and Head Start programs. And then it also reduces the scholarship recipient match for family child care providers. So Section 6 begins a series of sections that all make changes to the Child Care Assistance Program, or CCAP, that were all proposed by the agency for federal compliance purposes. So this is for Section 6 through Section 12. So Section 6 modifies requirements around when eligibility must be redetermined for families. Sections 7 through 9 all have to do with eliminating the scheduled reporter designation, which basically will then allow all families to have 12 months of CCAP eligibility. Section 10 limits or caps the family's copayment for the CCAP program. So it caps it at 6.9% of income rather than the 14% of income where it's currently capped. Section 11 sets out training requirements for legal non-licensed child care providers. And then Section 12 requires that childcare providers who accept CCAP, they submit data on child enrollment and attendance to the commissioner. Section 13 comes from House File 1916, the second engrossment. This is Chair West's bill. This section requires that CCAP providers sign each bill that they submit and declare under penalty of perjury that the information they've provided is accurate. Sections 14 through 17 are all from the agency's budget bill. Section 14 clarifies that the Quality Parenting Initiative Grant Program is actually going to be administered by DCYF rather than DHS. Section 15 directs the Commissioner of Children, Youth, and Families to allocate funding to counties and tribes to account for the change in the scheduled reporter designation. Section 16 directs the reviser of statutes to recodify that Quality Parenting Initiative Grant Program into a DCYF section of statute rather than a DHS section of statute. And then Section 17 directs the reviser to recodify an early childhood literacy program for children participating in Head Start from a section that belongs to DCYF to a section that belongs to MDE. And then moving on to Article 6, this is the DCYF licensing and certification policy article. Starting with Section 1, this comes from House File 2191, which was the agency's OIG bill carried by Representative Gilman. This makes changes related to moving to continuous licensing. Section 2 is a modification of House File 656 from Representative Zalesnikar. So this requires that the commissioner to grant variances for licensed capacity in child care programs if a few requirements are met. One of them has to be that the program's indoor space has to be within 100 feet of what is required for maximum enrollment based on the number of staff in the child care program. And then also the state fire marshal has to approve the variance. Moving on to Section 3, there are provisions in this section that represent two bills. One is from House File 2617, Representative Coulter's bill. This provides that a child care program license holder is allowed to request interpretive guidance on a correction order before going through the process of actually requesting reconsideration. This section also has a piece from House File 1897, the DE1 to that bill, which was from Representative Moeller. And this section modifies the timelines for when the commissioner can publicly post a correction order that's issued to a child care program to allow the program to request reconsideration before the order is posted. And then if reconsideration is requested, to have the commissioner make a decision on reconsideration before the order is posted. Section 4 comes from House File 2305, which is from Chair West. This directs a child care program to publicly post a conditional license that's accompanied by a maltreatment investigation for 10 years in the child care facility. Section 5 comes from the agency's budget bill. This has to do with federal compliance. It removes a prohibition on publishing documented technical assistance under the weighted risk system, which isn't actually implemented yet. But when that is implemented, that'll be a change. Section 6 is also from House File 2305 from Chair West. Like the other provision, this directs a child care program to publicly post a licensing action that's accompanied by a maltreatment investigation for 10 years in the facility. Section 7 is from the DE1 to House File 1897 from Representative Moeller. This changes requirements for posting licensing actions on the Licensing Information Lookup Public Website, or LIL. So it requires that the commissioner only post summary info on the website rather than letters or other communication between the commissioner and the program. And it also says that the commissioner needs to remove any summary info within 10 days of the length of time that the federal government requires the information to be posted. Section 8 is, again, from the agency's OIG bill. It modifies the length of time or provides that that when a child foster care license holder, the license can be issued for up to a year. once the provider hub is implemented. Section 9 comes from House File 1247, the first engrossment, from Representative Nadeau. And this makes permanent the temporary staffing changes that for childcare centers that were enacted by the 2023 legislature. So these are related to allowing an aide to take the place of a teacher during morning arrival and afternoon departure times. And then sections 10 through 20 all come from the agency's OIG bill. I'm not going to go through all of them, but these sections include multiple sections that change that requirement for child passenger restraint systems trainings. And then there's also a number of sections that address federal compliance for certified license-exempt childcare centers. So I will skip ahead to section 21, which starts on page 99. And sections 21, 22, and 23 all come from the DE1 to House File 2617, which is Representative Coulter's bill. Section 21 directs the Commissioner of Children, Youth, and Families to amend the definition of education and actually expand the definition of education for purposes of determining an individual's qualifications for working in a licensed child care center. Section 22 directs the Commissioner to develop and implement standardized licensing timelines and standards for licensing childcare centers. And then Section 23 directs the Commissioner to establish certain requirements for county licensors when they are licensing family childcare providers. And finally, Section 24 comes from House File 5655 with a few changes. This was Representative Lesnikar's bill. So this, in the DE1, what this section does is directs the Commissioner to amend the rules regarding when a caregiver's child may be excluded for purposes of determining a family child care provider's license capacity. So it would allow the caregiver to exclude one child, provided that child is at least 8 years old and the caregiver hasn't ever been determined to have maltreated a child or a vulnerable adult. And that concludes the walkthrough.
Great. Thank you, Ms. Mock, Ms. Sunderman, Ms. Punelli, Mr. Berg. We very simply could not have gone through this process without you, and we very much appreciate your support in both of our first time with the gavel here this year. All right. Next, we will have remarks from Commissioner of Minnesota Department of Children, Youth, and Families, Tiki Brown. Go ahead and introduce yourself for the record and proceed.
Thank you very much. Good afternoon, Chairs West and Katiza Watoon, members of the Children and Family Committee. I'm Tiki Brown, the Commissioner of the Department of Children, Youth, and Families. Thank you for having me here again today and for the positive committee process this session. It has been a pleasure working with you both, and I look forward to continuing to build a strong and trusting relationship among us. I'd like to start by acknowledging that the state's fiscal situation makes crafting a budget more difficult and appreciate the work that you put into this legislation. On behalf of the Department of Children, Youth, and Families and Governor Walz, thank you for including the DCYF policy bill in its entirety. The DCYF staff worked diligently to craft policy proposals. The changes in the policy bill are intended to provide greater clarity in our laws, make thoughtful policy changes developed through engagement with counties, advocates, and community, and through tribal consultation. The provision allowing the state to extend our contract with EBT providers to avoid a constant churn of contracting will support more efficient and effective government. The bill includes language ensuring clarity in statutes governing the responsibilities of county agencies to inquire into a child's potential Indian heritage through a child welfare or child protection case. Clarifying updates to statute will better ensure that it is followed. The bill also includes an important provision that allows local social service agencies to respond to reports of school absences in a holistic child welfare manner rather than a child protection investigation, should that be appropriate. A child welfare response will ensure that the local agency can offer the child and family services or supports to address the underlying causes of school absences, which are often due to the impacts of poverty. Thank you also for including much of the governor's budget provisions. The decision to fund establishment of electronic enrollment and attendance record keeping for the Child Care Assistance Program, or CCAP, is very much appreciated. This is an important program integrity measure. However, the failure to include an ongoing appropriation leaves the agency without funding to maintain the system and give ongoing support to providers after the 26-27 biennium. The inclusion of funding for the CCAP federal compliance will allow Minnesota to show progress towards meeting recent federal compliance audit findings and address some of the new audit requirements, both of which are needed to avoid penalties to the state's federal child care funding. Thank you for your attention to this critical need. I'm also happy to see that you've included the DCYF budget operating adjustment request for the first biennium. If we are not able to address the issue of resources in future sessions, our agency will struggle to meet the ongoing needs and will have to reduce operations in a way that could impact the quality of services that we provide. Inclusion of flexibility in how we manage our Indian child welfare grants to better support our tribal nations and communities in their child welfare work is an important change, as is the ability to use our public-private permanency collaboration to support transfers of permanent legal and physical custody to relatives, which is critical given that the number of relative placement continues to increase. Importantly, thank you very much for your strong commitment to funding the child welfare SSIS modernization. Only through partnership with the legislature will the state be able to modernize a system that has become an impediment for child welfare workers to provide children and families with the highest level of service possible. Modernization of SSIS will allow caseworkers to focus their time on child and families rather than spending hours on data entry. There are two additional provisions I'd like to highlight. By canceling all but the $1 million in transition funding for the Department of Children, Youth, and Families, you will leave the agency without resources needed to complete essential transition work. For example, without these one-time funds, the agency will not have the resources to complete specialized modifications in a new space that may be needed to comply with the Social Security Administration requirements. Secondly, the Great Start Compensation Support Payment Program provides payments to thousands of child care providers across the state. The program includes a 10% incentive payment for providers who accept early learning scholarships, CCAP, and serve families in areas across the state where the child care crisis is felt most acutely. It is concerning that we would end access to additional resources to providers who serve those with the most financial or geographic barriers to child care. To end on a positive note, I would be remiss in not offering appreciation for the committee's dedication in supporting important programs that help Minnesotans with low incomes get what they need to thrive, including food shelves, tribal food sovereignty programs, early learning scholarships, and the Family Assets in Minnesota, or the FAME program. Thank you again for this opportunity to share my thoughts on this important legislation, and I look forward to working in an ongoing manner with both of you and all of you. Thank you very much.
Thank you for joining us, Commissioner Brown, and for your partnership throughout this process. Members, do we have any questions or comments for the Commissioner while she is with us? Chair West.
Thank you, Madam Chair, and thank you, Commissioner, for coming before us. Just a quick question that came up the other day regarding MAFPA, which we were hoping to be able to address, and it seems many people have different interpretations of the implementation schedule of that, and I was informed that you do understand it better than most legislators. So could you elaborate on how MAFPA is going to be rolled out for the rest of the state rather than just the counties that are doing the pilot right now?
Commissioner Brown, didn't mean to demote you there. Chair West and I have had conversations about this, and it's possible that both of us, as well as other members on the committee, could use a little bit of clarification regarding the January 1 start date or go live date for statewide implementation. If that is moving from 0% to 100%, or will the other counties be able to follow a similar rollout to Hennepin and Ramsey counties after that January 1st go live date? Commissioner.
Okay, thank you very much, chairs and committee members. So MAFPA, the Minnesota African American Family, now I got to think about the acronym. Minnesota African American Family Preservation Act, Child Wellbeing Disproportionality Act. I added an extra act. Anyway, that is currently being implemented by the department. Hennepin and Ramsey County began on January 1st of this year to begin a phased-in process. Just today, we had our very first statewide work group meeting, which includes county members from across the state, county attorneys, members of the public, different community organizations. That group, along with members of our staff, will help determine the definitions that are somewhat open, still to be determined, and also help design and implement a process that when legislation as it is designed now is January of 2027 to be statewide implemented. But the work group is really designing recommendations to help us meet that guideline and also provide recommendations of what would make sense for statewide implementation. There have been questions on if we could implement a phased-in approach for other counties, and to be honest, I think we need to look a little bit more closely at the legislation as it exists, but we are intending to use the work group and the expertise within to help provide us a good, solid plan on how to implement statewide.
Thank you, Commissioner Brown. Chair West, any follow-up?
Thank you, Madam Chair and Commissioner. So at the date, the Chair Katiza-Watun actually refined the question quite well, but I'm not positive I followed the answer. At the date of implementation, January 2027, are these other counties going to have to go fully implement it, or are there going to be discretion allowed by the department to what degree the counties implement the legislation?
Commissioner Brown.
Chair West, that's what I need to look into a little bit more closely. We've had some interest from others to think about a phased-in approach. I would like to look more closely at the legislation to determine if that is in fact feasible, how it's written. But we do intend to take recommendations from the work group to help design a process for statewide implementation.
Chair West.
And on a different subject, just for the audience, the DE does not reflect the signed agreement between the chairs. And specifically, Article 5, Section 2, related to House File 15, removing the camera requirement, was not in the signed agreement, and there will be an amendment tomorrow to resolve that issue. Thank you, Madam Chair.
Thank you, Chair West. All right. Do we have any member questions directly to the walkthrough or the bill prior to taking public testimony? Representative Nadeau.
Thank you, Madam Chair. And Commissioner, I have a question on your operating budget increase. I mean, this agency just started, and you've already come in with a fairly significant operating budget increase. Can you just talk to that a little bit?
Commissioner Brown.
Thank you so much, Chair and members. The operating increase is designed to keep up with cost of living increases and additional costs as the agency exists currently. And so as those costs continue to rise, we would like to make sure that we can continue to pay our employees and keep up with additional costs. So the operating, I have, I think, some fiscal folks here that could explain in a little more detail than that, but that is the intent of the operating increase.
Representative Nadeau.
Thank you, Madam Chair. Thank you, Commissioner. I'm quite familiar with what they're for. I'm really more interested in did we underestimate the amount of staff needed, the wages that were going to be paid, the work that was going to be done? And I'm not trying to be unreasonable. I really it's a significant operational increase. I feel, and maybe you can tell me if I'm wrong. But I'm just wondering if there was something that went wrong. I mean, there's responsibilities in this that is being pushed back to MDE with corresponding dollars. And is there just, are we learning as we go and kind of on this thing? And if that's the case, by all means, I'm okay with that.
Commissioner Brown.
Thank you, Chair and Representative. Indeed, we are learning as we go. I think that is the very nature of the work that we're doing. We are not yet complete with our transition. We are finalizing DHS, OIG, and the Department of Public Safety programs to finish transferring at the end of June. And so we are learning every day as we go. I think the additional operating adjustment and costs that we have proposed is to just maintain our existing costs. Nothing has gone wrong, but we do indeed have unexpected costs and additional costs that we'd like to be able to maintain and support.
Representative Janow, final follow-up?
And thank you, Madam Chair, and thank you, Commissioner, and just in general to the two chairs. Thank you for the work that you've done on this bill. There's quite a bit in here. I think this is a fairly decent, policy bill. I am concerned, though, in that, we've heard a lot of testimony in this committee, and I get it. I'm just brand new to this committee. I don't hardly know a lot about what has been gone in the past, but I just don't see a lot in here that helps drive down the cost of care. I don't see a lot in here that, there's some things in the policy bill, and I appreciate all the things, especially you took with Representative Coulter's bill. I think that there's, in time, I think we're going to see some improvements in the regulatory environment that's surrounding, childcare and early education providers. But, this is, as the Commissioner said, this is, we took every governor's proposal. This is a very agency-heavy, department-heavy bill. And I just wanted to be able to state that I think and wish we could have done better for the families and the providers for our youngest people. And I hope that through an amendment process, we can at least have some discussion on maybe where we can move some of those dollars to better assist the Minnesota families that are struggling under the weight of childcare costs, and some of the providers that are struggling under the regulatory environment that's limiting their ability to serve more people. So thank you, Madam Chair.
Thank you for sharing those thoughts, Representative Nadeau. There are numerous changes from the governor's proposal that we made in our budget agreement, and we still have more work to do. So I'm not seeing any other names on the list, so we will move to testifiers. And again, Commissioner Brown, thank you so much for joining us today. First on the list, we have Christina and Cody Peck, followed by Janice DeGonda. If you would all come up to the testifiers table, and then when I introduce the testifier, I will list the next testifier so that you can just come right up to the table and introduce yourself and proceed with your testimony. We have over 20 testifiers today, both in person and virtual, so we just want to keep the process moving to make sure that we can hear from everybody. Please try to keep your remarks to 2 minutes, particularly if you've been able to join the committee throughout the session and have shared testimony with us before. I am going to just remind you to keep to that 2-minute time frame. So appreciate you for joining us, and please introduce yourself and proceed.
Hi, my name is Christina Peck.
You can go right ahead, Ms. Peck. Thank you.
So July 19th, 2024 is a day that should have been a happy one for my family. My son, Cassian, was 5 months old that day. However, this was not a happy day for us. July 19th, I received a phone call from the Blaine Police Department stating Cassian's daycare teachers had been arrested and Cassian had been determined to be a victim. The police then told me that he was telling all families involved to take their children to a children's hospital in Minneapolis. There, he recommended having a CT scan of his brain to check for brain damage and have a full body x-ray completed to check for any fractures. We were told that children his age can mask injuries due to them being immobile and unable to speak. We followed the police recommendations and had Cassian checked at Children's Hospital. It was found that Cassian had a fracture of his left tibia. The doctors told us that a fracture of this nature only happens from being squeezed too hard or pulled or dragged by his leg. They estimated the fracture to be about 2 weeks old at the time. We were naturally absolutely devastated. This was a parent's worst nightmare. We followed up with the Blaine police officer after receiving the results of the scans. This is when we were told that the cameras at the daycare he was attending only went back for a week. His leg fracture would not be on video as the system overwrites itself after 1 week. Due to the fracture not being on video, we have not been able to get a conviction for this crime. Had their footage gone further back, there would be a conviction for the atrocities committed against my son. The people responsible for my son's injuries would be facing proper justice for their actions. So today, we are asking the committee to support this bill as we feel it truly would keep children safe by having cameras present. It would allow people who harm children to be held accountable for their actions while preventing them from harming more children in the future. Thank you.
Thank you so much for sharing your story with us, Ms. Peck. Mr. Peck, are you intending to speak or just
No.
along for moral support? We appreciate either way. Thank you. All right, we'll move on to Ms. DeGonda. Thank you for joining us. And next we have Suzanne Dickinson.
Thank you. I have a 14-month-old daughter who's also abused at the daycare in Blaine along with the Pecks. She was 5 months old when we discovered the worst of her abuse. She had bruises covering her legs, her stomach, her groin, and her butt, all of which were covered by her clothing. It was not discovered until we were home and doing a diaper change. The severity of these bruises is what caused us to go into the hospital and what started this investigation. I can't believe that this kind of thing would happen, let alone at a daycare that had cameras. Surely they were being watched to ensure the safety of all the children throughout the center, as that was the first thing you noticed when entering this daycare, as there was a wall of screens showing the cameras in each individual room. We received a phone call from the detective on the case that our daughter was seen on camera being abused along with 2 other babies. They were being abused by not only one person, but 2. Then we found out that this daycare only kept footage for 1 week, which is highly unacceptable. There are over a dozen families affected by this case, but only 5 of us with charges due to having that video footage. At our latest court case 2 weeks ago, one of the abusers pleaded guilty to abusing multiple babies. However, she was only doing 90 days in jail. I know for a fact that if the footage was kept for longer, these women would be serving more time as more charges would be added on and more families would get justice for their children. Daycares need to have cameras, and it should be required for them to keep the footage much longer than a week. We need to prevent this from happening at any other daycare. Deciding to become a parent is the hardest, most rewarding thing that I will ever experience. My daughter is my heart and my soul. The world is a scary place, I know that, and there will be things that we cannot protect our children from. However, we should not be worried that our children are being abused by the people we are paying to watch, that we are paying to have watch over them when they are not in our care. And if it comes to finding out that they are, we need to do everything that we can to protect them. Please add this bill to the Omnibus Children and Families Bill and help pass this. Please help us prevent other babies from being abused, as no family should have to go through what mine is still going through since last July. We need to protect the children at all costs, and this is the start of doing so. Thank you.
Thank you for sharing your story with us, Ms. DeGonda. Again, my apologies, and I know that that's not enough, but we really appreciate you being here. And all those parents who have shared their difficult stories with us on the committee this year, we just really are appreciative that your littles have you to advocate for them and that you are using this opportunity to make change for those that come after you.
Thank you.
Next, we have Suzanne Dickinson, followed by Alexis Borgeson. If you can introduce yourself for the record and proceed.
My name is Suzanne Dickinson. Sorry. I don't know if what happened to me at the birth of my 5 grandchildren happens to all grandparents. They each showed me an empty piece of my heart that I didn't know was there, and then they quickly filled it. We all vow to keep them safe, and if harmed, we want justice for them. Some of that justice has come because of the fact Small World Learning Center had cameras. All justice will never be given as they deleted the video after just 7 days. At the plea hearing of one of my 2 abusers of my granddaughter, I held onto my daughter's hand, and then I turned and reached back to hold on to Christina Peck's hand, as we heard this woman admit to abusing 5 children. Some of the abuse we did not know about, and this woman would say, "I can't remember it all." Out of over a dozen victims, 5 were charged, but only 2 are convictions. Again, because the video was deleted. Cameras are needed at daycares with retention of the video for our most vulnerable children, those that cannot move away from their abusers, nor can they tell their parents that they have been hurt. We need HF 1915 included in the Children and Families Omnibus Bill. We need to do it for all of the children of Minnesota. Thank you.
Thank you for your time. We have Alexis Borgeson, and then we will have a couple Zoom testifiers. Chantel Gruba will be up next after Alexis. If you could introduce yourself for the record and proceed with your testimony.
Thank you, chairs and members of the committee. For the record, my name is Alexis Borgeson. I'm a foster youth outreach and engagement specialist for the Office of the Foster Youth Ombudsperson, often referred to as OOFI, and I also have lived experience in foster care. Our office is excited to be here today to express our gratitude towards Representative Hansen, the chairs, and everyone involved in supporting a critical budget-neutral funding remedy for our office. This support is not just a financial remedy, but also a recognition of the critical role our office plays in the lives of foster youth across our state. As you may recall, just a few weeks ago, our office, along with two powerful foster testifiers, spoke to this committee about the critical impact of proactive foster youth outreach and engagement. We shared about how important it is to connect with foster youth early to ensure that they are aware of their rights and available resources. Today, I want to take this opportunity to reaffirm the importance of that work. With this budget-neutral funding remedy, we will be able to continue to have the capacity to meet fosters where they're at, whether that's in a group home, residential treatment center, foster family, out of state, or in their transition into adulthood. This will continue to support our office's capacity to extend our outreach, educate fosters of their rights, and be there for these young people during some of the most difficult and confusing times of their lives. While we recognize that this funding is a temporary fix, it is an important one. Our office is the only state agency created by and for fosters, and because of this, we are committed to serving young people by fighting to ensure that they are receiving the highest standard of care, the care that they truly deserve by the state of Minnesota. Your support today enhances our ability to do this work throughout the biennium, and we look forward to sharing back with you what we have accomplished as a result of this funding over the next 1 to 2 years, and sharing our needs for ongoing support needed to continue this critical work in the longer term. Thank you for your time.
Thank you for joining us, Ms. Borgeson, for your work at OOFI. All right, we have a few Zoom testifiers joining us from afar. Chantel Gruba, you are first. If you could unmute yourself and introduce yourself for the record, will be followed by Karen DeVos.
Good afternoon, Chair Katiza Watoon, Chair West, and members of the committee. My name is Chantel Gruba. I am the owner of Iron Range Tykes Learning Center. And, oh, excuse me. I have been attentively following this committee's work, and I am very grateful for the opportunity to testify as you work out the details of the budget. I'm also grateful to Chair Katiza Watoon and Wes for truly digging into the really hard work of how to improve the lives of Minnesota's children and families. You have done a really exceptional bipartisan work. In that work, I want to specifically address the installation and maintenance of video security cameras in licensed childcare centers to monitor infants and toddlers. As a childcare provider and a mom, I can assure you that I understand the intention to enhance child safety. However, this proposal also presents a significant challenge and potentially unintended consequences that warrant careful consideration. There are substantial privacy concerns, not just from the surveillance perspective, but also in storage and handling of video footage and the digital nature of these systems. Unauthorized access could have devastating consequences. Surveillance can create a climate of distrust, potentially undermining the critical bond between childcare providers and teachers and the children in their care. Additionally, video footage alone may not provide a complete and accurate picture of interactions and events. Context is crucial. Relying solely on the video recordings can lead to misinterpretation and unfair judgments. I have grave concerns about how this would affect my ability to hire and retain staff, which is already very challenging. And if video surveillance is deemed necessary in childcare centers, why is it not necessary in other centers where there are vulnerable children and adults, like schools, childcare in homes, and assisted living? There are ways we can ensure children are safe and well cared for in high-quality childcare environments. We already do many of these things. And we could do more if there was funding to supply them. We have trained and experienced teachers and adequate staffing levels that allow for closer supervision. We have healthy and learning regulations. We have inspections that come. Reimagining licensed childcare in Minnesota so that licensors can focus on health and safety and not counting blocks are a priority. Quality of care versus driving this industry further into extinction will increase hoops to jump through and will keep kids safe, health, and learning. Thank you for your consideration.
Thank you for joining us today, Ms. Gruba. Next, we have Karen DeVos, and followed by Joe Pickett. You can introduce yourself, Ms. DeVos, for the record, and proceed with your testimony. Oh, unmute as well.
Members of the committee, my name is Karen DeVos, and I am the owner of Little Learners Early Childhood Centers in Ada and Halstead, Minnesota. Little Learners has 3 small sites, 2 locations that share campuses with nursing home facilities, and the third is a freestanding infant-only location. The communities we reside in have populations of 1,700 and 600 people. We are the epitome of rural Minnesota. I'm here today to express my concern with the requirement for video cameras in licensed childcare centers. I could talk today about child, family, staff privacy, keeping government out of private business, keeping a level playing field for all who provide care. In other words, why would we implement a law for one sector of licensed caregivers without implementing that same law for all? But honestly, I understand why this bill is out there. It comes from a place of great intention, fear, anger, and the need to change something that never should have happened in the first place. So instead, I want to talk about why this bill could be detrimental to my child care. I have the only 3 centers in Norman County. The reality is cameras don't make people not abuse children. Having well-educated, qualified, well-trained, emotionally healthy, trustworthy, supported teaching staff is how we ensure that the right people are doing the right things for our children every day. I use cameras in my childcare sites, partially because I want to and can't be in 3 places at once, and partially because it has become a great tool for training and pinpointing areas of need within our classrooms and environments. My cameras would not meet the requirements set forth in this bill. For me to upgrade at the level to which this bill would require would mean that I would have a significant one-time as well as an ongoing expense for 3 small childcare centers. There is no money in our budget for this. To find that money, I would need to raise my rates for parents, and I would probably need to pay my teachers less. Paying my teachers less would have the exact opposite effect than what we need for our teaching staff in our classrooms. We need teachers to feel supported, emotionally and mentally healthy, qualified, not stressed every single day worrying about how they're going to pay their bills, not worried about how they're going to make their food bill this month. We don't want to get back to the point where we can't afford to hire qualified staff and instead feel like the only people who are willing to work for our wages are unqualified people who are passing through before moving on to the next job. I ask that you reconsider the requirement for video cameras in licensed childcare centers. We all want our children to be safe. I am so sorry for all that the families have gone through, and there are no words to describe the outrage and sadness that I feel for all of you. However, I do not believe that this bill is the answer, and I sincerely worry what it could mean for the state sustainability of childcare centers, especially in rural Minnesota. Thank you so much for your understanding and consideration.
Thank you for sharing your experience with us today, Ms. DeVos. Next, we have Joe Pickett, who is also on Zoom. And then in the room, we will have Courtney Greiner, followed by Becca Kerfield. So if you could approach the testifiers table and wait your turn. Mr. Pickett, am I saying your last name correctly?
It's Piquette, but that's okay.
Pickett, all right. I apologize. Go ahead and introduce yourself for the record and proceed.
Sure. Good afternoon, chairs and members of the committee. My name is Joe Piquette. I'm a very recently retired owner-operator of 2 Primrose schools here in the Twin Cities. And I've been following this issue since last summer and understanding the intentions, as previous testifiers have said, and some of the trauma that these previous families have gone through most recently. I still don't believe that cameras are going to achieve the goals or are a practical solution to create a safer and higher quality childcare environment. So I am urging a no on this amendment. I can make a couple of quick points that I don't think have been made yet. First, it will put a significant burden on childcare centers to create policies, train on these policies, making sure that multiple cameras are operating properly at all times and that video is being kept and then disposed of per the law. That means more resources being spent on one more regulatory item in an already very highly regulated environment. Second, the notices that this bill is going to require is going to create an atmosphere where parents are going to want regular access to the video, mostly so they can conduct their own investigations of any bruises or other marks that they see in their children. And keep in mind that children, especially toddlers, are getting bumps and bruises all the time from the different activities that they're doing during the day. That's their exploring, that's their learning, and the teachers are taking very good care of them. They're addressing anything that happens to them. But to have it all on video and then it's being watched by parents, they're going to see other things going on in those classrooms with other children, and that's probably going to create a problem with privacy of those other children. So you'll have children in a classroom, you might have some behavior issues, and now these parents are seeing this on the premise of video, reviewing video for their own child, and now there's no way of us controlling what parents will see or what they will say to other children or other families about children behaviors they observed on videos. So those are two things I think that need to be considered. In the end, I don't believe this bill is going to achieve those objectives of making it a safer environment for children. At best, it only tells you what happened after the fact and long after anything could have been done about it. I believe a better method is providing better support and supervision of teachers in the classroom so that they are not left on an island all day and trying to fend for themselves. They need support from their management and center owners, and that is a better
Mr.
solution.
Paquette, if I could just ask you to wrap up.
Sure, that's a better solution, I believe.
Thank you so much for sharing your experience and joining us today.
Yep.
All right. Next in the room, we have Becca Kerfield. If you could introduce yourself for, sorry, what? Okay, all right, go right ahead.
Hi, I'm Becca Kerfeld. It's hard to sum up the most traumatic event of mine and my family's lives in just a couple minutes, but I'll try my best. In February of 2022, my husband Jason and I brought our 4-month-old daughter Willa to the ER because we thought she might have pneumonia. They did x-rays and they saw that she had 4 broken but healing ribs. They asked us if we knew what happened. We had no idea. We were informed that they suspected abuse and that we had to wait for an ambulance to arrive and take Willa to Children's for further testing. When we got to Children's, it was late, so they transferred us to a room where we would stay overnight and Willa would undergo testing in the morning. I turned off all the lights and rocked my double rainbow baby. I sat there staring at her and giving her a million kisses, believing it was going to be the last time I got to do so. I was terrified she would be taken away from me for something I did not do, and I felt horrible that I didn't catch this earlier. In the morning, Willa had her scans. She was so scared, and she cried the whole time. It broke my heart. Not only did my baby go through the pain of having her ribs broken, but now she had to undergo all of these scary and uncomfortable tests. When we went back to our room, Dr. Hudson came in to talk to us. He's a doctor that specializes in child abuse. We were confused how this was never caught by us or any doctors, as Willa had been in for a couple medical visits. He said that infants' bones are much more pliable than adults, and it can be easy to miss. He also told us he believed she had been squeezed, and that it happened approximately a month ago. Detectives and a social worker came to interview us. My husband was first, and then it was my turn. I've never even had a speeding ticket before, so this was downright terrifying. When the interview was done, we were told Willa would be going home with us. I was so relieved, and thus began trying to figure out what happened. I was talking with my mom, and we recalled a week at the end of January where Willa was fussier than usual. I remembered getting an email from her daycare provider saying that Willa had a good morning, but then was crying really hard for the rest of the day and wasn't eating well. Due to that email, I took her to urgent care after I picked her up, where she received a diagnosis of fussy infant. I told the police about this, and they said they'd look into it. They also asked for our phones so they could do a forensic investigation, and we agreed. We also agreed we'd be willing to take a polygraph test. A few days later, the detective informed us nothing suspicious was found on either of our phones. However, they had interviewed the daycare provider and found several inconsistencies between what she told them and what they found on her phone. They asked her to take a polygraph test, but she refused to cooperate any further and got a lawyer. The police told us that there was nothing more they could do since she got a lawyer, there was no video evidence, and Willa was too young to even talk. Every month, for over 2 years, I had been checking the DHS website on the status of her daycare license. In mid-April of 2024, I found something. Her license had finally been revoked, but this was due to the abuse of another child. Now, I know that this bill does not apply to in-home daycares. However, it's a good place to start. Hopefully, one day, in-home providers will have the same requirements. The safety of children should be our priority. If there had been cameras in Willa's daycare, we would have justice. Perhaps she wouldn't have even been hurt at all, along with the other children who were victims of this provider's abuse. Instead, the abuser has had no real consequences apart from having her license revoked. I urge you to please approve this bill and take the steps necessary for preventing a story like Willa's from ever happening again.
Thank you so much for sharing that experience with us, Ms. Kerfeld, joining us, and I'm so sorry for what happened to Willa. Next, we have Courtney Griner, who will be followed by Commissioner Lori Halverson. Ms. Griner, you can introduce yourself for the record and proceed.
Sure. Good afternoon, everyone. My name is Courtney Griner. I'm the owner and director of Escomanese Child Care and Preschool. Sorry. No family should have to worry about that. No family should have to worry about the safety of their child being dropped off, especially in places that you trust to be taking care of them. And I'm truly sorry that your children were harmed. It breaks my heart, obviously. I got into this business because I love kids, and I wanted to create a space that was safe and loving and all of those things. And hearing all these stories, like, I so badly wish that mandating cameras in these classrooms was a magic solution, but it's not. To be clear, I support cameras. I have them in all of my spaces in my child care center. They're super helpful for transparency, accountability, training, but mandating them statewide without the substantial funding or safeguards just creates problems for providers who are already struggling. In addition to the ongoing, thank you. In addition, I'm always a crier, so just bear with me. In addition to the ongoing costs of maintaining the system, privacy is an issue. Footage of one child inevitably includes others. So granting that parental access without legal oversight just risks violating the privacy of uninvolved children. We have to have the proper protocols, like requiring the subpoena and warrant. We still can require the cameras, you know, it just has, providers also have to have safety and legal steps as well. This will still protect families and will ensure footage is used responsibly. Most importantly, and I can't stress this enough, cameras don't prevent harm. True prevention comes from investing in qualified staff, maintaining strong ratios, creating teacher teams that hold each other accountable, creating culture that holds each other accountable, and providing the resources our children need to thrive, which is why I truly applaud the bipartisan efforts I've seen in this committee over the last few weeks. As you can imagine, I cried when I watched providers testify about the Great Start compensation supports and how providers would have to close without them. I cried as I watched parents testify about the Great Start affordability scholarships and how those would fundamentally change their lives. And I also cried as I watch providers testify about their early learning scholarships and how many kids are on the waiting list that they can't help. Guess what? I also cried when Representative Coulter came up here and introduced HF 2617, a bill that would transform how we do childcare licensing in Minnesota. I watched childcare providers from across the state tell all of you how transformational it would be. We're really on the cusp of something big and amazing, and childcare providers have been working on this for decades. I'm excited to show everyone that we can do big things for Minnesota providers, children, and families, and we can do them together. Thank you for your time.
Thank you for joining us, Ms. Greiner. Next, we have Commissioner Lori Halverson, who will be followed by Stacy Hennon. If you could approach the testifiers table so we can just keep rolling, that would be wonderful. Go ahead and introduce yourself, Madam Commissioner.
Thank you, Madam Chair. Thank you, Chair West, as well, for your work on this. I'm Lori Halverson, Dakota County Commissioner. You guys have a big and hard job, and we're hearing about all the work that you're doing in a bipartisan way to support the most vulnerable among us. I'm here to talk about the provision in the bill with regard to the $40 million funding included in the proposal for improving our SSIS systems. I'm here on behalf of the Association of Minnesota Counties and the Minnesota Intercounty Association, also known as MICA. The Association of Minnesota Counties represents all 87 counties, and we at the counties are your partners in getting the important work done to protect the most vulnerable, to care for our kids, and to ensure that the programs that are being required by the state and federal government are being carried out in the most effective and efficient ways. Unfortunately, efficiency when it comes to technology is not serving our counties well right now, and we really need your partnership, and this $40 million will go a long way to helping us improve our systems. We have staff that are working on systems that were built in 1989, in the early 1990s, at the same time, we've got these same staff are generally entry level, they're gonna be younger, and they're walking around with computers in their pockets. And then they're having to figure out how to use what we call green screen technology and intense workarounds to try to get the data that we have just entered into the system. The data doesn't even get to get used for the analysis that we could use it for, the power that data have. So what we get from the state electronically has to become an analog, essentially. It becomes paper, and then it gets all re-entered by staff. These are people who are trained to care for people, and they are spending their times in front of computer screens doing very clever workarounds. I really give them a lot of credit. In Dakota County, we've had to add dozens of staff in order to try to keep up with the data entry work that is being done, and also to manage the fact that our staff are turning over so quickly, because people are in this business to help others, and they're spending their times in front of computer screens with really obsolete technology. I can't even tell you. And having served in your seats and knowing what you're doing, I can tell you we've talked about this for years at the Capitol. And you guys have worked hard to try to give us resources that we need to get it done. But we haven't fully funded it all over the years. And so bits and pieces happen. It hasn't trickled down to the work our counties are doing. The investments that you're making in improving SSIS systems will go a long way to helping us fully fund SSIS and get the correct kind of systems in place so that we can really use the data and we can get folks in the correct programs and doing what we need to do. It comes along at a time where we know that
going to ask you to wrap up.
Okay.
Commissioner,
that funding federally is a little bit uncertain, and so these dollars that you're looking to invest are going to also go a long way in creating stability in our county systems. Anything that we can do to help, any questions we can answer, we're here for you. Thank you so much.
Thank you so much, Commissioner Halverson, for coming to visit us again at the Capitol. And on a slightly lighter note, because we're hearing many, many serious and important testimony today, Commissioner Halverson is a former representative here in the House and served on a committee in which our very own Chair Nolan West was a page at one point in time. And she informed me that she would, CLA, excuse me. CLA, he says. And that she used to bring candy to that very committee and ask him to pass it out to the members. So I think we have a little bit more insight into the chair here. All right, so we have Stacy Hennon up next, followed by Lisa Thompson. Again, feel free to come up to the testifiers table and sit right down so we can just keep rolling. After Ms. Thompson will be Sydney Spreck. So go ahead and introduce yourself and proceed.
Good afternoon, Madam Chair, Mr. Chair, and members of the committee. For the record, my name is Stacy Hennon. I am the Director of Western Prairie Human Services and the Director of Traverse County Social Services. I am testifying on behalf of the Minnesota Association of County Human Social Services Administrators, or MACSA. As Commissioner Halverson testified, we couldn't thank you more for the investments in SSIS. This technology platform is critical to everything we do in child protection. We'd also like to express our gratitude for the provision that authorizes a child welfare response for educational neglect and habitual truancy concerns. This change allows workers to engage families in a voluntary manner while also allowing for a child protection response when and where it's needed. Furthermore, we appreciate the time and attention to address issues in the child care area, including online and annual reporting efficiencies. The areas that we believe need further attention are in the areas of the relative and licensing relationship with private providers, and in the area of the out-of-home case plan summary documentation. In the area of relative and kin licensing, we recommend addressing private providers charging county administrative fees after the private provider conducts the licensing. From the county's perspective, these administrative fees per youth per day have high variability in what's provided and between providers, and often result in charges that in most instances are more than the total cost of care per child. In the area of the out-of-home case plan summary timelines, we recognize the need to work with caregivers and parents to provide a preliminary summary, but in practice, the out-of-home placement plan needs to be completed and signed off by the court before we're able to offer a summary of the plan. We're committed to working with the authors and DCYF to address the issue and ensure that the policy is achievable through practice. In closing, I'd like to emphasize our commitment to addressing the disproportionality in Minnesota's child protection through ensuring successful statewide implementation of the Minnesota African American Family Preservation and Child Welfare Disproportionality Act. Noticeably absent in this proposal is any policy or support language regarding the resourcing and successful implementation of the Act. We encourage lawmakers to address resourcing the required components of the Act, including things like active efforts, development of culturally responsive and community-based services like family resource centers, and centralizing the case review function within DCYF with additional consideration for approaches that allow for additional counties to phase in the program. Counties urge the legislature to address these issues prior to session's close to ensure that our system is positioned for successful implementation. In closing, thank you very much for working with counties over the process of compiling these recommendations and responding to woeful inadequacies of the technology that supports our work with families.
Thank you for joining us, Ms. Hennon. Lisa Thompson, ombudsperson for family child care providers. Go ahead and introduce yourself and proceed with your testimony. You'll be followed by Sydney Spreck and then Peter Wojtak.
Hi, thank you. Chairs and committee members, my name is Lisa Thompson, and I am the state's ombuds for family child care providers. This ombuds office serves as an advocate for family child care providers in the state. And thank you for this opportunity to share with the committee the input that I have received from and the voices of family child care providers who have communicated with this ombuds office. First, I'd like to share the supportive input received and items that are relative to the recommendations that I've made in the ombuds annual reports. First, such things as clarifying that the data privacy for Great Start Compensation Program support payments, improving the maltreatment training content, specifying timelines for agency responses, requiring specific timelines for county licensors to communicate and respond to license holders. Sadly missing from language moving forward is language that would require self-reported violations to be noted in public licensing information website. The language that would require specific factual conditions observed by the licensor to constitute a violation, and any broadly impactful changes to the capacity and ratios for family child care licenses that require 2 adults. Now, some specific input on provisions that are moving forward. First, the provision to exclude one of provider's own children. I've received consistent and very passionate input from providers over the 2.5 years that I've served in this position that it is really needed to be fixed in the capacity and ratios for those 2-person licenses. The cameras issue has been covered in great detail from other testifiers, and I won't go into the details that I have collected, except to say that I've received very, even though it doesn't apply to family child care right now, there's gratitude for that, but they have raised concerns that it would eventually cover family child care. And because family child care is in the personal home of the provider outside of business hours, that would really be an important exclusion. And thirdly, the background study violation fines being increased. This office recommends that this committee reconsider that proposal to increase the fines. As one comment from a license holder is the higher fines will not serve to prevent background study violations without first fixing the problems in the systems that family child care face. I have some examples here. I know our time is short, so I will not give those in the testimony. And fourth, the posting of license orders for up to 10 years when maltreatment is included in that doesn't recognize that this is the home, the family personal home, and the requirement to post a order by the front door for 10 years is significantly challenging for providers. The high quality of childcare is about children's development and learning through positive and nurturing and bonded relationships with their caregivers. Anything that distracts from that is an additional burden. And every additional regulation and governmental requirement really distracts from that work and robs the children of the vital time that their caregivers need. Thank you.
Thank you for joining us, Ms. Thompson. Right, Madam Sprick, you can go ahead and introduce yourself for the record and proceed. And then we do have a couple Zoom testifiers after that.
Thank you, co-chairs and committee members. For the record, my name is Sydney Spreck, and I am a political affairs coordinator at the Minnesota Association of Professional Employees, or MAPE, which is a union of over 18,500 state workers across all of Minnesota's agencies, boards, and commissions. Thank you for the opportunity to share our concerns about the budget bill. While we thank the committee for funding the Department of Children, Youth, and Families operating adjustment in the 26-27 biennium, we are deeply concerned that this adjustment is not continued into the next biennium. Operating adjustment funding ensures that agencies can retain experienced staff who run the programs created by the legislature. The adjustment accounts for the increasing inflationary costs of current staff and the overhead costs associated with operations. Not funding these adjustments forces the agency to do the same or more work with fewer resources year over year. We were also concerned that the reallocation of the DCYF transition account is below the governor's recommendation by $3.4 million. This is another funding stream that is intended to maintain agency staffing and programming as employees transition from old agencies over to DCYF. Ignoring operating adjustments and reallocations of funding also leaves these programs vulnerable to bad actors seeking to defraud the government. It takes significant staff and resources to maintain internal controls and oversight of these programs, particularly during times of transition to ensure continuity and program integrity. The bill also requires the agency to establish new timelines for conducting regular inspections of licensed child care centers. With no funding for additional staff, you are again asking our members to perform an increasing range of functions without adequately providing the resources necessary to be successful. We urge you to reconsider the amount you have allocated for the DCYF operating adjustment in fiscal years 28 and 29, and the decision to cut the reallocation of the DCYF transition account. Thank you for your time.
Thank you for sharing your thoughts, Ms. Sprecht. All right, since you're already up there, Mr. Wojcik, I'm totally botching your name, I think. So you can go ahead and introduce yourself, and then we have 2 testifiers on Zoom, and then I think one final one on Zoom later on.
Thank you, Madam Chair and members of the committee. My name is Peter Wojtak, Government Relations Manager with the Food Group, and we want to thank the committee for recognizing the urgent need in this bill by including one-time funds for the Minnesota Food Shelf Program. This investment will help provide assistance to the emergency food system at a time it's desperately needed, with food shelves and food banks facing record levels of demand due to high food prices and economic hardship in communities statewide. At the same time, federal challenges have placed additional strain on Minnesota food shelves with the loss of federal funding through the Commodity Credit Corporation, resulting in a 30% reduction in free food availability across the network. And this loss makes it even more imperative to strengthen state-level assistance. We recognize the difficult position the committee faces in balancing priorities with a very limited budget. And to meet the rising demand, we urge the committee to consider providing additional resources for food shelves and food banks, organizations that work tirelessly to keep shelves stocked and to serve neighbors and families in need. Across the state, over 400 food shelves stand as a vital community pillars, ensuring that individuals and families have access to nutritious food during difficult times. And their dedication is unwavering, but they need our collective support to continue this essential work. And by strengthening investments in the Minnesota Food Shelf Program, we can continue to ensure that food shelves are able to continue to meet the growing demands and needs of their communities. We're grateful for your leadership, commitment, and continued support in addressing hunger in Minnesota. Thank you.
Thank you for your time. We're going to move over to Zoom. First, we have Kathleen S. McHenry. If you could unmute yourself and introduce yourself for the record, and you will be followed by Virginia Witherspoon.
Yes, thank you. Good afternoon, chairs and members of the committee. My name is Kathleen McHenry, and I am testifying on behalf of the Early Care and Education Consortium, a nationwide alliance of high-quality child care and early learning providers with 260 member locations in Minnesota. First, I want to unequivocally state that we share your goal of ensuring all children are cared for in a safe and enriching facility. Children's safety is a child care provider's #1 most important duty. As a mother with 2 young children, my heart breaks for families who have gone through these terrible situations. While we support many of the funding and policy provisions in the legislation, I am here to testify in opposition to the proposed video recording and retention requirements. Each of our member providers have a different policy around videos, but none of them would comply with the current proposal. There is a significant cost to obtain cameras, record and store footage, upgrade internet capabilities, and hire staff to manage the cameras and footage. The minor appropriation is a fraction of the cost needed to comply, which will be unbearable for centers alone. Unfortunately, costs will be passed along to parents in the form of higher tuition. Just important are serious concerns around privacy, particularly privacy of non-consenting minors who are subjects of these videos. In short, requiring centers to obtain cameras and record and retain footage will have serious implications for the childcare industry and for parents who rely on childcare centers to work. And while I truly wish they would, cameras will not prevent terrible situations from happening. I do want to suggest pursuing subdivisions 7 and 8 of the previous bill, which would require providers to have written policies on their use of video cameras and provide those policies to all enrolled families. This is a common sense policy that supports both providers and families while not increasing costs or risk associated with doing business. ECEC is committed to working with the committee to find solutions that protect child safety while promoting affordable, high-quality care for more families. Again, while it would be great if a statewide camera policy was a solution to terrible situations, this policy will only have unintended negative consequences on availability and affordability of childcare. Thank you for your dedication to Minnesota's youngest learners and their families.
Thank you for joining us, Ms. McHenry. Next, we have Virginia Witherspoon. You can introduce yourself, unmute yourself, and proceed.
Thank you, Chairs West and Katiza Watoon. I'm Virginia Witherspoon, and I'm the Executive Director at Channel One Regional Food Bank in Rochester. Channel One is the regional food bank for Southeast Minnesota. And what food banks do is we find the food for the food shelves in our region. That can be donated from manufacturers, produce from farms, food rescued from retail stores, government commodities, and the food that we use our money to buy from Minnesota producers. Then our truck drivers drive the food to the food shelves that give the food to the people who need it. So when our driver, Jason, loads the pallets in the truck in Rochester and brings the food to, for example, Bryceland Food Shelf, Red Wing Food Shelf, or the La Crescent Food Shelf, that's 70 to 80% of the total food that food shelf gives away to shoppers in their communities. Channel One serves 13 counties, and each place we serve is rural, other than the city of Rochester, and we are facing a hunger crisis in Southeast Minnesota. In our region, Channel One distributed 18.9 million pounds of food in calendar year 2024. This is an increase of 35% year over year. And thank goodness, because the increase in need is staggering. In January of 2022, we had about 15,000 shopping visits in the region. Fast forward 3 years, and it's 35,000. Channel One runs a food bank, and we also have the largest food shelf outside of the metro area. 25% of our shoppers are driving from outside of Olmsted County for food. Many of those are driving 45 minutes to an hour. And why? Because they can't get the food in their communities that they need. So we're serving about 10,000 household visits per month, and that's 2,500 times that people drive into Olmsted County for groceries. And the February shopping experience at our food shelf wasn't great. For the first time in 2 years, we served less than 500,000 pounds of food in a month. And that's not because the need is going down. This is because there's not enough food in the food bank. Between this February and last February, the weight of the inventory on hand fell 59%, or 714,000 pounds. And that's because food donations are down, the cost of food is rising, and the need is rising simultaneously. Our food bank is already making hard choices. We're not buying eggs and we're rationing milk. If it were not for the one-time funding from the legislature last year, we would not have enough food right now. We appreciate the $1.5 million in the DE amendment. However, without substantial funding from the state this year, people will be standing in line for food in greater Minnesota by autumn, and we will be turning them away. Thank you.
Thank you for joining us, Ms. Witherspoon. All right, we have one more testifier on Zoom, so I think we're just going to do that. 2? All right, maybe 2. Austin Rayleigh III, if you're on and can unmute yourself and introduce yourself.
Hey, everyone. Chairs, members of the committee, thank you for the opportunity to speak today. My name is Austin Rayleigh, and I represent KinderCare. KinderCare proudly serves over 4,600 young children at our 64 high-quality early learning centers across Minnesota. Our world-class educators build confidence in students by providing high-quality educational experiences that meet the unique developmental needs of all our children in our care. KinderCare proudly serves all children regardless of background and financial circumstances. We have approximately 47% of our children we serve who get financial assistance who are offered through the CCAP program. Now, while we strongly support the efforts to keep children safe in licensed child care settings, I am here today to express our opposition to House File 1915, which mandates the installation of video cameras in child care centers. We have several serious concerns with the bill, beginning with privacy. Capturing and storing video of infants and toddlers raises critical questions. Who owns the footage? Who has access to it? If licensee obtains the recordings, are they subject to public records requests? We must ensure that we are not inadvertently compromising the privacy of our children and our staff. All of our ECE professionals are trained in mandated reporting if neglect and abuse are suspected. Further, we train and encourage our professionals to self-report if licensing violations are observed, abuse and neglect are neglect and abuse being the most serious and critical. Lastly, funds are better used elsewhere in early child education. Limited childcare funding in our under-resourced industry should be used to improve classroom environments, support staff development, and expand access across underserved communities. The biggest concerns facing childcare is affordability and access. We are concerned that this legislation tackles neither. So with that being said, I appreciate you all for taking the time and consideration to hear me out. We urge you to reconsider this legislation and work with providers to make a more balanced, supportive approach that protects our children without placing an undue burden on our care centers. Thank you all, and hopefully you all have a great evening.
Thank you, Mr. Raley. All right, finally, there's one more Zoom testifier, and then we'll wrap up here in the room. We have Dr. Lisa Hohensteiner. If you could unmute yourself and begin your testimony.
Chairs and members of the committee, my name is Dr. Lisa Hollensteiner. I'm a retired ER doctor, now serve as chair of Safe Passage for Children of Minnesota, which is a nonprofit committed to protecting children from abuse and neglect through policy and system change. Our organization worked closely also with a number of frontline professionals who worked with abused children, and we strongly support Representative West's bill to include video cameras and retained recordings in spaces where toddlers and infants are being cared for in licensed daycare centers. DHS receives dozens of reports of possible abuse and neglect each month at licensed programs that serve children. Last year, 93 children from licensed child care centers in Minnesota had findings of maltreatment, such as sexual and physical abuse, made by Child Protection. Of course, Representative West's daughter was one of them. The state of Minnesota sends inspectors on an annual basis to ensure child care centers are complying with safety standards and child-to-staff ratios. But what about every other day of the year? Who's watching them? Children under 3 are at the highest risk for death and injury due to abuse. Without cameras, we have no way of verifying injuries on a non-mobile infant or a nonverbal toddler. Without cameras, we have no way of holding child care providers accountable for their actions. We also believe that video cameras can be a protection to child care workers where there is an injury, and now there's objective record of events that show that an injury was not due to abuse. Also, parents would likely see the availability of video cameras to be a selling point in selecting a center, knowing that staff are under video surveillance and that it would be possible to verify the cause of a potential injury. Child safety above everything should always be a priority. Thank you for the time and opportunity to speak in support of this bill.
Thank you, Dr. Hohensteiner, for joining us. All right, we have our final 3 testifiers. We have Erica Moss with Think Small, followed by Claire Sanford. And then Lisa Lane will be last. Can you go ahead and introduce yourself and proceed with your testimony?
Thank you, Madam Chair, members of the committee. Erica Moss from Think Small. Thank you for the opportunity to share our thoughts on the proposed omnibus bill. I'll start by saying that we are grateful that under the circumstances, the committee was able to find $6 million for early learning scholarships. I know many of you on this committee agree with us that that is a worthwhile investment, and we are excited to continue working with you all to do even more if we can in the next phases. A couple additional things in the bill. We have questions regarding the provision in Article 4, Section 2, eliminating additional payments in the compensation support program for providers serving high numbers of children using CCAP or scholarships. We have for many years pushed for public resources to be both tied to quality and concentrated in support of children with the highest needs. We're concerned that this change works against those goals. We appreciate the preservation of most of the IT funding for children and families. We'd like to see the bill include specific language directing the agency to focus on a payment system and family common application tool. These projects will further the committee's goals related to program integrity and efficiency. And finally, we appreciated the committee's discussion around the visionary proposal brought forward by Representatives Coulter and Nadeau regarding childcare licensing and licensing and quality assurance reform. And we look forward to continuing to work with the committee on that issue in the future. Thank you.
Thank you for your time. Ms. Sanford, go ahead and introduce yourself.
Thank you very much. Good afternoon, Madam and Mr. Co-Chairs and members. I am Claire Sanford. I am on the board of the Minnesota Child Care Association and chair the Government Relations Committee. The main thrust of this omnibus is regulatory and would make very significant positive change for providers' ability to run programs as we continue to await the completion of the overall regulation modernization project, and other possibilities that Ms. Moss just mentioned were introduced by Reps. Coulter and Nadeau this session. We are specifically appreciative of the following items for child care centers in this bill. The space variance for centers, if approved by the fire marshal, I'm a firefighter, go fire safety. Interpretive guidance on correction orders, summary documents on the public licensing website, making a staff flexibility past 2 years ago permanent, expanding the definition of education, and standardizing licensing visit steps and expectations. In the realm of Child Care Assistance Program CCAP federal compliance and program integrity, we are happy to see copay adjustments to lower family costs, eliminating the discriminatory practice of schedule reporters, and ensuring that all children get 12-month service authorizations. However, we are disappointed not to see some other pieces that are federally required in this bill, prospective provider payments and paying providers on an enrollment versus an attendance basis, which are federally required to match private market payment practices. We're also happy to see that an electronic attendance system for the state is funded for CCAP initially, but hopefully that will roll up into the infrastructure we need for Great Start scholarships, which are due to start in Minnesota in 2028. On the funding side, we also really appreciate that $6 million was found for early learning scholarships in a tough environment. It's about $90 million under what we need to maintain current funding levels, but we acknowledge the commitment of the chairs on this issue. We also share concerns about the elimination of the 10% bonus in Great Start compensation payments for providers serving low-income families or rural and urban low-access areas. This is a concern because this program is already facing a drop of $75 million in funding this summer, and this is not good because it will directly affect teacher wages and benefits going backwards, and Commissioner Brown and Ms. Moss also mentioned concerns with that. We're also very pleased that this omnibus does not include a mandate on all child care centers for cameras and has strengthened privacy and security concerns for those voluntarily using them. Items related to video surveillance and childcare in this omnibus are moving in the right direction and have changed greatly. We don't feel they're ready for prime time yet. We would prefer to see a study to understand the true cost needs of such a proposal, or an incentive-based approach to changing provider practice around videos, or a focus on those with very poor safety records. In closing, I would like to make a few remarks on the amendment that would bring back a mandate for all child care centers serving infants and toddlers to have video cameras in their programs. And I also honor all of the parents here advocating on behalf of their children for things that never should have happened, things that should have been prevented. No state, to the best of my knowledge, mandates video cameras in childcare. And we share a concern that's been previously shared about why only a subset of childcare would be required here, and why not other places where vulnerable adults and children, the elderly, those with disabilities, are served who may not be able to report abuse. Serious cost concerns remain, and the concern is the need for struggling providers to pass these costs on to struggling families. Our members are reporting actual costs to comply between $6,000 and $20,000 a center of unexpected expense, just for initial compliance, not ongoing staff time, video storage, and equipment maintenance. Even the increased appropriation doesn't make a dent in that. This mandate would have the potential effect of lowering access to infant and toddler care, the most scarce and needed in our state, and most certainly raising prices for families. There are already providers who choose not to serve infants because of the expense of that age group, and such a mandate could cause providers to rethink serving infants and toddlers at all if such a mandate became law. Let's focus instead on right-sized policies and resources to prevent abuse in the first place. Thank you very much, and thank you to the co-chairs and all members of this committee for how you have conducted this committee this session. It's really been a delight.
Thank you for your words and for joining us today. Finally, we have Lisa Lane. If you could introduce yourself for the record and proceed with your testimony.
Thank you. Chairs and members of the committee, my name is Lisa Lane, and I represent Open Arms of Minnesota. Thank you for the opportunity to testify today in support of House File 2436 Omnibus Bill, and specifically the Prepared Meals Grant Program. Special thank you to the chairs for including the Prepared Meals Grant Program in the Omnibus Bill. For almost 40 years, Open Arms has been preparing and delivering medically tailored meals to vulnerable, sick, and food insecure Minnesotans. We prepare over 1 million meals per year in our metro area kitchens, and we deliver and ship those meals to thousands of Minnesotans in the metro area and in rural counties who are both food insecure and living with life-threatening illnesses like cancer, heart disease, diabetes, and renal failure, or they are struggling with high-risk pregnancies and trying to ensure healthy deliveries and healthy newborns. The Prepared Meals grant we received last year enabled us to ship 24,000 meals in the past year to 109 Open Arms clients across Greater Minnesota and provide 1,000 meals weekly to mHealth Fairview patients who are both food insecure and critically ill. All of the clients served by the Prepared Meals Grant Program are more than 200% below the federal poverty guidelines. Clients are made up of individuals who are either unhoused, regularly sleep at homeless shelters, live in remote rural areas and have unreliable transportation, or they are referred to us directly from healthcare providers ranging from the Mayo Clinic to Duluth. Our shipped meals are their only option for the kind of nutrition necessary for their illnesses. Current data from Minnesota hospitals reveals the substantial burden of food insecurity among critically ill individuals in Minnesota is particularly acute. For example, 82% of cancer patients experience nutritional challenges during treatment. 73% of critically ill patients report missing meals due to lack of energy to prepare food. Inclusion and support of the Prepared Meals Grant Program in the Omnibus Bill positively impacts vulnerable, critically ill, and food insecure Minnesotans by ensuring they have access to nutritious food, which significantly improves their treatment outcomes and recovery process. Thank you for recognizing the importance of the Prepared Meals Grant Program by including HF 2436 in the Omnibus Bill. Thank you for your support.
Thank you for joining us today, Ms. Lane. Members, that is our final testifier. We have miraculously gone through all of the testimony on time. Our next meeting is tomorrow. Chair West will have the gavel. It is our next and hopefully our last meeting. A reminder to please clean up after yourselves with all of our candy wrappers, and reminder also to save your papers in your packets for tomorrow. The bill is lengthy, and the rest of the written testimony can be saved for tomorrow for reference as well during markup and discussion. With that, committee is adjourned.